Hello friends. Today we are going to discuss about World Mental Health Day 2025. This year theme is access to services during mental health in catastrophes and emergencies. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. Every year on 10th of October, we come together to bring awareness regarding mental health issues. We also fight against stigma and discrimination with regard to person with mental illness. It is an opportunity to make policymakers aware that there are mental health issues in the general population, not only the person with mental illness, but also their family members struggle for providing care. So we need to make aware not only the politicians, policymakers, bureaucrats, and public at large. In this regard, this year theme is access to services in mental health emergencies and catastrophes. Why this theme? At this point of time, across the world, there are war, natural calamities, terrorist activities, road traffic accidents, and many other emergencies which are occurring on day-to-day event. During this time, invariably we are providing physical health. Mental health is completely neglected. Hence, this year theme is access to mental health services. This is a very important theme for World Mental Health Day 2025. Let's discuss about this theme. The theme calls for a raising awareness to make action so that access to treatment to everyone, not only for the general population, and special focus need to be given for people who are in catastrophes and emergencies, specifically who are affected by terrorism and war. Now let's understand what is mental health. Because in this theme, access to mental health services. So without knowing what is mental health, invariably this theme will be lost. So mental health is a state of well-being where individual realizes their own abilities, can cope with normal stress of life, can work productively, and able to contribute to their community. So here the theme is very clear. The mental health means normal stress of life. But during catastrophes and emergencies, such as natural disasters, we require support. So we need to provide mental health support during these phenomena. So let's understand the mental health from a spectrum perspective. Mental health is a spectrum. On one end of the spectrum is mental illness. On the other end of the spectrum is mental wellness. Here, we need to focus on mental illness and mental distress. Invariably, people during various disasters, war, catastrophes, emergencies, the people with distress are more. Of course, some of them may develop mental illness, but the mental distress is phenomenal during these kind of phenomena. Hence, we need to make access to mental health services. It is a basic human right for all people to have a good mental health and physical health. If you look at the World Health Organization definition, every citizen has a right to the highest attainable standard of mental health and also physical health. Of course, social well-being is also an important component. So here, access to mental health services is not just providing services. It should be available everywhere, accessible easily, acceptable by the general public at large, and it should be of good quality of mental health care. So the dimension is not just making access. So my dear friends, We need to keep this in mind when we are providing mental health services for especially the people who are affected with catastrophes and emergencies. Now, what is this catastrophes? Catastrophes means a large scale, often sudden events that causes widespread destruction, disruption, large number of casualties, distress to life and property. This requires a coordinated response, not only locally, regional, national, and international support is required. For example, earthquake, floods, hurricane, large scale fire, and also terrorist attack. So, my dear friends, catastrophes equivalent to natural disaster, man made disaster like war, terrorism. So, here we require support from all the actors across the world. What about emergencies then? Emergencies are unexpected situations that pose an immediate risk to the health, life, property, or the environment for a selected group of people. While this is serious, but it is localized and it is managed by the community's own resources. It can be addressed quickly if they are prepared. For example, road traffic accidents, localized fire, or a health emergencies in the family. So, this year theme has both component of catastrophes at large and emergencies which is localized. Now let's look at the phases of disaster or emergencies. I have published an important article with regard to disaster management and mental health perspectives, published in Indian Journal of Psychological Medicine. I request you to go through this so that you will understand what is the role of mental health professionals, general public at large in providing support for the survivors either in the disaster, terrorism, or else even if they have a local emergencies within the family. If you look at this picture, it clearly indicates during disaster there are various phases. First is the pre-disaster phase. How the community is coping, doing well, are they prepared for any disaster? Do they have enough of resource? Whenever there is a disaster, immediately there is a heroic phase. Every person, they come together, they protect each other. This is very common in India and various other Asian countries. The community forgets about their individual needs. They think collectively for the community. This is where the heroic phase starts, and then the honeymoon phase kicks in. Here, the public at large, politicians, policymakers, philanthropists, every will come together. They gather their resources, provide support to the survivors. At the same time, they make various promises for rehabilitation. This approximately lasts 2 to 3 months. After the disaster has been gone after 3 months, disillusionment phase kicks in. All the resources will be evaporated. The people who are focusing on them will forget. The media will forget. This is the time mental health resources should be pumped in. We need to provide mental health support, social support, economic support. This is the phase which starts 3 months to next 3 years. That is the time we need to focus on mental health so that the rehabilitation of the community occurs beautifully. Sometimes there will be anniversary reaction after the 1 year, second year. We need to manage the population at this period of time, my dear friends. So, mental health experts, mental health resources need to be geared up to provide care during the rehabilitation phase. So, the honeymoon phase is the time the mental health resources required is there, but it is more during the disillusionment phase and rehabilitation phase. So, moving forward, my dear friends, in a disaster situation, during catastrophes and emergencies, in simple words, these are normal people in an abnormal situation. Abnormal situation is war, terrorism, even natural disaster can be considered. They are distressed population. However, there will be few people who develop mental illness who require support. So if you look at the prevalence of mental illness in general population, approximately it is 10%. Prevalence of mental illness during disaster, catastrophes and emergencies, it increases by 2 to 3 times. That is 20 to 30% develop mental illness, my dear friends. What is this suddenly increase? Yes, the evidence is very clear. There are research papers which clearly said that during catastrophes, during emergencies, disaster, pre-existing mental illness will worsen. There are various reasons for that. One is non-availability of medicines at that time. Imagine there is a disaster, floods, earthquake, or suddenly there is a terrorist attack. Now all the medical shops will be closed. And at that time, availability of medicine becomes very difficult. Or the person may forget to carry the medicine. They are moving from one place to another. And during this stressful situation, the pre existing mental illness will worsen. At the same time, if some person has already been cured with mental illness, the chances of relapse is very high during this stress. So these two important points need to be kept as soon as the disaster strikes. That is, making sure the medicines are available, the stress is minimal, displacement is very minimal, and make sure that relapse of mental illness do not occur who are already recovered. Hence, the focus should be very specific on this population immediately during the disaster. Further, after maybe 1 to 2 weeks to 1 month, the disaster stress can cause various mental illness such as substance use, substance abuse, anxiety disorders, post traumatic stress disorder, depression, insomnia, non specific somatic symptoms, attempted suicide, personality change. So, invariably, this will kick in after 2 weeks to 3 months, and we need to provide care at this point of time. Now, what is the critical gap and why this theme was focused? Please understand, this Mental Health Day 2025 clearly brings the focus. We need to make awareness about mental wellness, mental distress, and mental disorders, not only to the policymakers, politicians, bureaucrats, healthcare workers, but also to the general population at large to know what is mental health, mental distress, and we need to provide care with regard to mental health. And many a time, immediately after the disaster, the psychiatrist is not part of the disaster team because many a time the policymakers are not aware of this. Why should a psychiatrist be part of the team? For simple reason, rapid assessment of the mental health needs. What about the mental health resources available in the affected region? How to provide mental health services in the affected region need to be planned. And of course, these psychiatrists are invariably doctors. They not only can provide care with regard to mental health, they also are doctors. They need to work like any other doctor, providing physical care and also mental health care. Unfortunately, in developing countries, trained mental health resources is very abysmal. The psychiatrists are very less. Many of the psychiatrists may not be aware about the disaster mental health, and unfortunately, they refuse to be part of the disaster mental health or during emergencies and catastrophes. There is a need to make aware about the emergencies and the need of mental health care. And at the same time, access to psychotropic medication and social interventions need to be done immediately after the disaster or catastrophes. For simple reason, there are many people who are normal but in abnormal situation. We need to hold their hand, provide psychological first aid, and we need to link them with the resources. We need to coordinate and communicate with various agencies, NGOs, and also the government to make sure their physical health is kept adequate and mental health is supported. The mental health resources need to be geared up for a long term, from 3 months to 3 years, at least, my dear friends. Of course, if you look at the Western literature, they say 4 years. Why 4 years? That is the fourth year. We need to prepare the community so that they can take care of themselves. That is empowering the community for subsequent emergencies, disaster, and catastrophes. So, what should be done now? We have we have a role to play, each one of us. Massive awareness program with regard to mental health, army of trained counselors with regard to psychological first aid, dealing with distress. Simple counseling techniques need to be taught. Pre disaster, we need to train all the healthcare professionals, first responders, politicians, policymakers. They need to know how to deal the disaster and catastrophes. We need to focus on research. The simple reason is many a time in this disaster we forget evidence based policy making has to be done. Integrating mental health professionals, psychiatrists in the emergency responder team is essential. Leveraging technology in providing disaster mental health care, specifically telemanas. You can bring in various bots. You can bring in AI for simple psychological first aid. For example, in a war zone, the mental health professional may not be able to move in. In such a scenario, you can bring in chatbots, telemedicine, telepsychotherapy to support the population. In this regard, NIMANS and IH Delhi is working on the small language module to train the mental health professionals, at the same time prepare a simple psychological first aid training module, and also at the same time providing support to the population. This small language module can be installed in a simple laptop, and the care can be given without going online. So, this kind of research is ongoing, and this can change the way mental health is providing provided during disaster. Hence, we need to strengthen disaster mental health services, integrating into district mental health program and also digital mental health program. In this regard, Telemanas is already playing a crucial role. We need to make aware of Telemanas services across the country. At the same time, in India, we have a mental health legislation, that is Mental Health Care Act of 2017. This is phenomenal legislation, but not been implemented in the letter and spirit of this legislation. The Mental Health Care Act of 2017 clearly says in the preamble, this legislation is to provide care for persons with mental illness. That means providing care, providing access to care. At the same time, it also says to protect and promote and fulfill the rights of persons with mental illness during the delivery of these services. So, the Parliament of India has promised not only providing care with regard to mental health, but also to protect and promote the fulfill the rights of the person with mental illness during the delivery of the care. In this regard, Section 18 talks about access to mental health care. It is just not access, right to access to mental health care. Here, it is for every person. It is not only just for person with mental illness. Every person shall have right to access for mental health care and treatment. That means it's not only just for person with mental illness, every person. That is the word. That means not only for person with mental illness, a person who is affected by disaster, affected by emergencies, catastrophes. It is the duty of the government to provide care. What is this providing access to care? Affordable cost, good quality, available in sufficient quantity, accessible geographically, without discrimination, and acceptable to person with mental illness and their family members. What are those access? Outpatient services, inpatient services, halfway home, sheltered accommodation, supported accommodation, mental health services to support the families of person with mental illness, home, hospital, and community-based rehabilitation, child and geriatric mental health services. So, this is the bouquet of services need to be provided not only during disaster and emergencies, but also in the time of peace. So, there is a huge responsibilities not only on the government but also on every citizen. Here, Section 18 further says we need to integrate mental health services with the general health services. Minimum mental health services should be provided at the district level. And if it is not available, compensation has to be given to the person with mental illness if they had to go somewhere else to access services. Free treatment for people with below poverty line, destitute, homeless people, and mental health services should be equal to physical health services. Essential psychotropics made to be given free of cost. Not only allopathy medicine, Ayurvedic medicine, all those medicines should be made access to public at large, and the government should make budgetary provisions inadequately on priority basis, equity and progress every year. To conclude, my dear friends, this year theme is very apt. In this regard, Mental Health Care Act of 2017 of India, that is right to access for mental health care, is already been passed in the parliament. We need to make it reality in India, not only during normalcy, and we need to focus during disaster. So let's join together and make access to mental health care a reality, my dear friends. So, this year theme is very essential, my dear friends. Access to mental health services during catastrophes and emergencies. So, stay safe. Thank you. Bye.